Thank you so much for joining. Today I will be talking with a doctor of integrative medicine, Vanden, who is not employed by Nature's Sunshine. Thank you so much, everyone, for joining the Dr. Jamie podcast today, where we will talk about things that truly matter: people, plants, and process. Today's topic is really centered around cardiovascular health. I hold this one close to my heart as a CPR and first aid instructor. I love heart health and just anything that we can do to keep the heart healthy. Dr. Vanden is with us today. He's going to explain the cardiovascular system and why it is so important to have a good grasp and understanding of your circulatory system, why it's important, and things we can really do to help improve upon where you're at in your journey with your cardiovascular health. So thank you, Dr. J, for joining us today. I'm excited to have you on. And I will pass it over to you to talk about yourself first. Give yourself an introduction here, because I know we're really good friends. But for those that are just tuning in for the first time, could you tell them a little bit about yourself, and then we'll move into the cardiovascular system?
Okay, thank you, Dr. Jamie. I appreciate that. Hello, everyone. I'm so thankful and grateful to be a part of this podcast. My name is Dr. Vanden. I hail from Green Bay, Wisconsin. I've been in medicine for over 40 years, both allopathic and integrative, holistic, natural, whatever you want to call it. I probably studied it. I do have 3 PhDs, 2 doctorates, 4 board certifications. So it's not about, hey, look what I did. It's about, I really take my job seriously. And I've had the distinct honor to help over 20,000 patients in my career. And so I worked in surgery, I've worked in holistic medicine, I've traveled the world, I've got to teach, lecture, I've written books, I have a private practice. So it keeps me very much in the loop of what's going on. And today's topic is, like you said, very close to the heart. And this is a very important subject for everyone, because everybody I know has a heart.
Mhm. Well, I think everybody I know except one. I'm just joking.
Oh,
Um,
we better not go there.
we should not go there. All right, let's keep it professional. People, plants, and process. Got
There
it.
you go. Yeah.
Okay, so I know for the listeners, they would, for those that are just tuning in, can you talk a little bit about the circulation of the heart, and we'll
Yeah.
use it as our
Yeah.
starting point?
Thank you. I used to teach anatomy and physiology at the college level, so it was pretty interesting. But we'll just start with a few things I think that are maybe things you did not know. When we talk about the heart itself, it never gets a rest. It's a muscle, primary organ, just to the left of our chest. And its job is to push blood 60,000 miles. Every time that heart beats, you feel that one heartbeat. That blood is going through your entire anatomy and back 60,000 miles. People
Wow.
are often blown away by that, right? I mean,
I'm blown away by that. And I'm
yeah. And
a
so when
doctor
you,
of acupuncture. That's incredible.
that's incredible. And 75% of your circulation is what we call microfibers. Little tiny threads. 75% of that. So 75% of that road is really tiny stuff that we can't see, like what's in our fingers and our eyes, our ears, our kidneys, right? So when we talk about heart and circulation, I want you to, really give that some thought. Wow, that's a long way to go. Could there be problems along the way? And the answer is yes. So that's a good place to start, would you think? Right?
Definitely. I think
Yeah.
so. The next thing that comes to mind is cholesterol. And
Mhm.
I think a lot of people are thinking the same thing. Is cholesterol the real issue when we're talking about the heart?
That's a great question. And believe me, we could do 10 podcasts on that one. But set the stage a little bit, right? First of all, about every 20 seconds, unfortunately, somebody just in the United States has a heart attack. That's a lot. And about every 39, 38 seconds, somebody's going to die from one of those. Right? What is that? That's like 92 people an hour. So, when we look at everything that's happened in our world, right, this is still the number one killer above anything else. So we have to pay attention to that. And there's been a lot of attention given to, cholesterol, as you have said, right? So is that cholesterol the problem? Is it the absolute core of why people have these statistics? And the answer is it's not. In my opinion, professional opinion, cholesterol's a myth. And that often shocks people, especially when I lecture on this, because cholesterol is a necessary hormone. Interesting. Every cell in your body has a cell wall, right?
Mm-hmm.
Yeah, that wall itself, which protects us from toxins, is made of cholesterol, right? So think about it. If we were to lower our cholesterol too much, would we affect the cellular wall? And studies, white papers have shown yes. So sometimes that gives us an additional threat to the cellular structure. Now, that being said, is all cholesterol the demon? No, there's only one part of cholesterol that's an issue. And I'm sure everybody listening has heard about total cholesterol. And what we're learning is that's pretty much irrelevant. Yeah, it could be a large number, but it really doesn't give you a true picture.
So is total cholesterol part of this HDL, LDL stuff
Mhm.
that we're always hearing about? I know a lot of people think high density lipoprotein. What is that? Is that the good one?
Mhm.
Is that the bad one? Low
Yeah,
density lipoprotein,
that's a
is
great
that
question,
the
right?
bad
Because we
one?
hear these terms, right? It used to be total cholesterol, I think, when you and I were younger, Jamie, and
What do
now
you
we're
mean?
dating ourselves,
I
right? But
am
all
young.
you ever heard was total cholesterol. You remember that? And then all of a sudden these words came into vernacular like HDL and LDL, right?
Mhm.
Because as they started to study this necessary molecule, they broke it all down into molecules and they started saying, wait, not all cholesterol is bad. So to answer your question, something called high density lipoprotein or HDL is actually our good cholesterol. So you can always remember high being good, right?
Okay,
High
like you're gonna
density.
give it a high five.
High five. So,
Okay.
that's a good cholesterol. And the higher that number, the better you are. So total's not really giving us a picture.
Okay.
Then, just like blood pressure, where you have, a systolic number and a diastolic number, an up and a down, cholesterol, then we see a bottom number, right? And that one is the LDL, the low density lipoprotein. And
Mhm.
that's really been the one that's been demonized. And but it doesn't end there. It gets even further that we found out now that in the LDL itself, that number is not accurate. And sometimes there's a lot of fixation on that LDL number. Oh, you got a really bad LDL. You got to get on this prescription. You got to do this. You got to do that.
Mhm.
You don't really have all the information. In that LDL, there's three components. There's a large molecule, a medium molecule, and a small molecule. It's like the three bears. The really small guy, we call small density LDL or SD LDL, is the sticky one. And it gets sticky by a process known as oxidation. So
Mhm.
that SD LDL is a number I think we should all be concerned with, everybody. But what if you have a bad LDL and it's really just the large and the mediums that are kind of off, but the SD is okay? And that's kind of why I'm saying we need more information, right? It has to go deeper that because not all cholesterol is bad. If you didn't eat it, your body will make it. It's critical, right? But
Mhm.
we do know this, okay? Our lifestyle is definitely a big part of this. And how that affects us, high sugar diets can actually elevate things like triglycerides. They can lower our HDL to good guys. They can raise some of that sticky LDLs too. What we eat, what we drink, how we think, all affects those numbers, right? So it's a big part of everything that's happening, right? And if we could do anything to take care of 60,000 miles, including the pump, we're going to change the outcome in our quality of life and how long we live.
Let's go a little deeper into lifestyle.
Hmm.
What are some things that we can do as a population to really help promote good heart health, and keep our circulatory system just at optimal condition?
Yeah, that's a great question. Right. And that's the most beautiful part. And the thing that I've been training on most of my career is so often, and bear with me, Jamie, because when you ask these questions, my mind just starts going nuts, right?
I know it does.
Because I'm like, oh, I got to say this, I got to say that. So I'm trying to get it all out. But bottom line is, too often we get bad news, we get a diagnosis, we hear things from our physicians, and they tend to really bum us out. Now we're all scared, right? What you have to remember is that you have a lot of power. And that's the beauty of these podcasts. Thank you, Jamie, for doing these. Because we get the information out to say, oh, no, 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 wait a minute, time out. There are things you can do, you have control of. For example, nothing ever goes here by accident, right?
Oh,
You don't trip on the sidewalk, fall on a donut, and it slides down your throat.
I was thinking about brownies all of a sudden. I just don't know why. Maybe
But
we ate them last week.
so we choose what we drink, what we eat, we choose, right? And if we can make better choices, that's one part of lifestyle.
They were organic, Dr. J. I'm
Mhm.
just need to throw that in there. They were organic and no added sugar. Is that part of a good lifestyle change? I didn't
You're
go
going in the right direction.
I didn't go for the big stuff or, brownies, but
Yeah,
we went for like the organic,
right.
you know,
Absolutely. I'm
good
a big
stuff.
fan of organic.
Mhm,
I'm not a fan of GMO foods. I am a true naturopath at heart.
mhm.
I work very hard to make sure I'm eating live food, not dead food. I want two-thirds of my diet to be alive. I know that's hard, and that's hard for a lot of people, but before we get too far, I just want to go back to that, what you can do. And number one is exercise. We're talking now just the cardiovascular system, not everything in life, but exercise, right? And I don't care what you do, just do something. And
Mhm.
I've seen studies say as little as 20 minutes 3 times a week. So don't think
Even
of it as like,
walking,
got to go to the gym, right? Yeah, walking is an
walking.
excellent idea,
We do that
right?
all the time. We go on our lunch break and
Yeah,
we walk.
that's all you got to do. 3 times a week can lower cholesterol by 40 points.
Wow.
So, fresh air, exercise, right? Can we walk? Sure. Can we move? Absolutely. That's not that difficult. And as I mentioned, diet, nutrition, right? You got to think about what's going in. What is a good fat? What's a bad fat, right? Like you said, plants, people, right? I'm big on that. What we're drinking, right? I mean, diet sodas are not going to help our cause. And we got to get those fresh veggies, and we just have to think before we eat. And then, of course, I'm a big fan of this because you can't do everything right. And as we're finding out, it's a toxic world. There's toxic air, toxic water, toxic foods. And at the cellular level, it's all about toxins out, nutrients in, is supplementation. It's such a important part of what you're doing. And I just everybody listen to me for a second. If you're not supplementing, you need to start. And if you are, congratulations. But we can always do better. The whole purpose of these podcasts is to get the information out. There's a lot of people think, oh, I'll just take a multivitamin and that's all I got to do. Uh-uh. Not in this world. If you've been paying attention, there's a lot coming at you, and there's a lot that can affect your cardiovascular system. There's genetics, there's stress, right? There's secondhand smoke. I mean, there's so many things, toxins, radiation. You got to up the ante. I'm not doom and gloom. I'm an optimist. I'm going to say to people, hey, here's what you can do. We're going to get you walking a couple times a week. We're going to get you drinking enough water. We're going to start helping you eat plants. And if you can't eat plants, I'm going to find some green superfoods, right? Some green zones, some harvest. I'm going to get some stuff in you to make sure you're up in the ante. And then talk about supplementation for specific things. So thank you. I got a little excited there, but
I know. I like it when you get excited. You're like I don't know, you're like this vast well of knowledge. So I ask you a question
thank you.
and you go on and on about all the most awesome things that we really just want to pick your brain and get this information out to the rest of the world. So supplementing, we were talking about that and we talked about the greens, which
Hmm.
sound very yummy, especially because I'm hungry right now. So I feel like
Well,
making a smoothie or getting some greens in there is a really good idea.
right. As long as it's green, it's not that difficult. And that's where supplementation can be very valuable, not just physically, but mentally, emotionally, spiritually. Because you always feel better when you're doing something for you and your family and your friends. When you can, something as simple as liquid chlorophyll is not difficult. You add it to water and drink it. How hard was that?
I
You
mean,
know, I
I
mean, that's simple. Or like you said, I'm gonna have a smoothie, but I want to put something green in it. You know, I'm a big fan of a product called Nature's Harvest. To me, it's the best meal you're gonna eat all day, hands down,
That's awesome.
especially for the cardiovascular system.
And then let's talk about foods a little bit for heart health. What I've heard is the colors of the rainbow, not only for your gut, but also for your heart. Is that true, or should we just be sticking to greens, or should we kind of create a variety there?
Yeah, that's a great question. And that's gonna like boomerang us back to almost where we started.
Mhm,
When we talk about eating the rainbow, it's like if we have a plate of food in front of us, that's something that you should always try to create, right?
mhm,
You'll love being a chef if you start understanding the value of color because we eat with our eyes. You know, when you have a bunch of white brown stuff on your plate, it's not as appealing as a purple broccoli or I'm sorry, a purple cauliflower. You know, something that's got a lot of power, a lot of oomph to it, or yellow or orange. But why is that important? Because, you know, like carrots and broccoli and green, you know, all these different colors, they help the body to not oxidize. And that's an important point I want to get across in this short time that we have. Oxidation is a huge part of why we get sick and causes all kinds of dis-ease, right? What does that mean? It means if we're not getting these rainbow foods, these colors, these antioxidants, we're aging too fast. Everything in the body is slowly dying, and that's not an exaggeration. It's so simple. It can be just getting a low carb diet, bringing in some good fibers, adding some B vitamins. You're already going in the right direction. But if you're not eating properly, well, then the supplementation can only help you so much. Now, if we
mhm.
put good color foods together with excellent high quality supplements, we're going to really get somewhere. Now we get synergy, we get explosion, we get lots of antioxidants. We start stopping all these processes like oxidation, which affects your cholesterol. So, as I mentioned before, small density lipodensity proteins, right? That's SD, LDL. When
Mhm.
that oxidizes, then it gets sticky and that'll stick inside those arteries. You don't want any stickiness anywhere in 60,000 miles, or what will happen is when the heart pumps, it's going to feel resistance before that blood comes all the way back. And if it feels resistance, let me ask you this, Jamie, what will the heart do?
I mean, all that's coming to my mind is I'm thinking about atherosclerotic plaquing, right? Where we
Excellent.
we
Yeah,
make poor food choices, our arteries become
we're getting
clogged,
oxidized,
we're getting
we're laying down
oxidized.
sticky cholesterol.
That's less oxygen to our
Yep.
brain, to
Now
our
think about it
lungs.
from a tube standpoint, right? So
Mm-hmm.
if we get little oxidation in there, right, little clumps, right, small density lipoproteins start sticking to our artery
Get
walls,
backed up.
what happens to the inside diameter of that pipe,
Yeah,
right?
it's smaller and smaller. We get back
Okay, so what's the heart going to do?
the same
Push,
thing.
push harder.
Mm.
It's got to go 60,000 miles to come back. So, wonder what would happen to your blood pressure if you did that. And
I'm guessing
oftentimes
it's
people are like,
gonna
well, I
go
don't know
up.
what causes high blood pressure, and my doctor didn't know why either. Well, I didn't offer you the only insight. I offered you one insight, is that we don't want any blockage. We don't
No.
want any narrowing of any of that 60,000 miles. Otherwise, the heart's got to work harder. If the heart works harder, that's going to raise our blood pressure. That's going to peel years off our life. That could cause strokes and all kinds of nasty things, right? So we got to
Mhm.
kind of reverse that. And there's a lot of factors that go into that, including blood sugar. So I'm a big fan of like chromium, you know, just a chromium a day helps keep the cardio doctor away.
That's good.
Avocados, avocado a day keeps the cardiologist away. You know, you got to think this way. If I'm eating and taking in supplementation for the purpose of increasing my circulation, helping my heart work better and giving it some love, I'm going to do great. So I have a simple saying here. Circulation is life, stagnation is death.
Hmm.
Choose.
I definitely don't want to have to choose the stagnation. Stagnation is bad. And just you talking reminds me of a patient that I saw in grad school. He came in for chest pain. He had high blood pressure, and his perception was he was only having, in his lifestyle, he was a construction worker, he was only having 1 to 2 sodas a day. But really, and after talking with him, he was having 1 to 2 big gulps
Mm.
of soda a day for years and years. So I just, again, and everything you said, I'm thinking about him and this lifestyle that he created for himself in his mind. He thought he was making good choices, only having 1 or 2 sodas. But really, I mean, have you ever had a big gulp before? I think there's like 8 sodas in one. So he's having at least 16 sodas per
Mm.
day
Yeah.
working on the job. He made some good lifestyle changes, and he wanted to move away from, making those bad changes to then being positive. He went down to just drinking 2 cans of soda. He would bring them to work with him instead of 2 big gulps. So again, I think that we can focus on little improvements like walking, drinking more water,
Sure.
getting those greens in there.
Yeah, like why can't we replace that big gulp with maybe a big gulp of like, like a antioxidant blend like Tygo, where we can
Yeah.
mix a little water or a chlorophyll in water, which still tastes great, right? We can drink that in a tumbler or get on our bike and do all that fun stuff. You know, not here to pick on soda, but as long as you mentioned it, what you
Mhm.
need to understand about that is that's a pH issue, potential of hydrogen, right?
Mhm.
Our bodies want to be about 7.0, which means we don't want to be too acid, we don't want to be too alkaline, we want to be just right. Everything. When it comes to circulation, it's always the three bears. Just right. So anyway, soda has a pH of like 2.5.
Mm.
That's far from 7. And, 1 12-ounce can of carbonated soda, sugary drink like that could equal about 3 quarts of water to try to neutralize it in a day. And how many people are following one small soda with 3 quarts of water? They're not.
They're not.
And so if you're doing that in one day, you're going to be all right. It's not going to kill you. But like you said, this is a lifestyle. I'm doing this every day for 20 years. It's going to add up, right? So, yeah, you've got to change some of your behavior.
Mhm.
Yeah.
Well, I know we talked about chlorophyll and some of the others.
Mhm.
Are there any other products that you recommend to just help us stay on this healthy heart regimen, or in conjunction with the rainbow foods that we're putting in our diet and other lifestyle changes?
Yeah, that's a great question because I get asked that a lot. I have a private practice and people ask me that every day. They're like, if there was one thing I could do,
Just
and
one.
that's fine. And I have an answer. CoQ10.
Okay.
CoQ10. And here's why. This is really, really cool. Every cell in your body, it doesn't matter. Take a cell out of your finger, your hair, it doesn't matter, and look at it under a microscope. Look inside the cell, and what you'll see is 1 or 2 organelles called mitochondria. And their job is to make energy. So every cell in your body makes energy, right? And it uses these little tiny powerhouses to make energy for that cell. So it's got 1 or 2 or 3 of them, right? Guess what powers that? CoQ10. That's the primary fuel. Now, here's the interesting part. If you take a cell out of the heart muscle and look at it, just one cell from your heart muscle, take that out and look at it, has hundreds of mitochondria per cell. What does that tell you? It says my heart needs a lot of what? CoQ10.
CoQ10.
Yeah. So if there was one supplement I would take on a daily basis for life, and that's my opinion, it's
Okay.
CoQ10. Especially with all medications and toxins and stress, and that's just one aspect, right? But I think a lot of times people are like, well, is there like a multivitamin? Is there like a supplement that kind of hits everything? It might have CoQ10, might have B vitamins, might have chromium, might have antioxidants, things that we all talked about in this short time. And
Mhm.
yeah, there's a product called Mega Chel, CHEL, which stands for mega chelation. And that can be used as a daily vitamin mineral supplement. That's just one. And I know there's a lot of other offerings as well. But if people have a history of heart disease or they're worried about it or they just want to up the ante, I would use this product called Mega Keel. And you can take like 3, 4 a day, one with each meal, and you're giving yourself the best, vitamin, mineral, antioxidant complex I've ever seen, designed just for the cardiovascular system. So you might want to take 1 or 2 or 3 of those a day and maybe pop a CoQ10. And if you're doing that and changing the few things that we talked about, making small changes, maybe dropping some diet sodas, increasing your water, add a little chlorophyll, do a little of this, take a walk, breathe, you're already changing the outcome of what's going to happen. Absolutely, no doubt.
I think this is great insight into heart health, and I really appreciate your expertise on this subject matter.
Oh, there's so much to talk
I know we're just scratching the surface here. I feel like
Right.
we need to have another podcast on heart health and
Oh,
just
yeah,
continue
I would love
this
to be a part of that.
conversation.
Yeah.
One thing I will mention though for this podcast is anytime it comes to your health, be sure to check with your physician first. Any sort of dietary changes you make, any recommendations that we give on this podcast. Again, if you're going to make a big change, check with your primary care physician, your practitioner, in place that you confide in, and make sure that that's the right regimen for you. But Dr. J, I appreciate you so much. You're a good friend of mine, and I'm so thankful for our friendship. I'm so thankful that you are who you are. And I really look forward to having you back on the Dr. Jamie podcast, where again, we talk about people, plants, and process. This podcast was centered around heart health and the circulatory system. So thank you so much for that. Is there anything else you'd like to add before we sign off?
No, but I loved your comment, Jamie, about eat the rainbow. I can't emphasize that enough. Eat with your eyes. Eat with a blessing. Keep God in the middle. It'll all be okay.
It'll all be okay. All right. Thanks everyone for tuning in, and have a wonderful day. I appreciate you tuning in to the Dr. Jamie podcast. If you're interested in getting updates on when we release new videos, please click the subscribe button below and you will be notified and you won't miss out.